Welcome to The Explainer. Today, we're digging into a really core skill in community health nursing, the bag technique. Now, you might think it's just about what a nurse carries in their bag, but it's so much more. It's really a masterclass in safety, efficiency, and professionalism, all wrapped up in one elegant procedure. So, let me ask you a question to get us started. What do you think is a nurse's single most important tool for stopping infection during a home visit? You might be thinking of a specific piece of equipment, but the real answer? It's not a thing at all. It's a process. It's a very precise technique for how they use their entire kit. So here's our game plan for this explainer. We're going to start with what the bag technique actually is, what we're calling the nurse's secret weapon. Then we'll dive into the 4 core principles that are its absolute foundation. From there, we'll walk through the whole procedure, step by step, point out the crucial do's and don'ts, and finally, we'll bring it all home and talk about why this simple bag technique really matters. Okay, let's get right into it. Why would we call something as ordinary as a bag a nurse's secret weapon when they're out in the community? Well, because at its heart, the bag technique is a deeply systematic scientific process. The whole point is to turn a regular nursing bag into a kind of portable clean zone. It's all about protecting both the patient and the nurse from any kind of cross-infection. And you can see here, it's about so much more than just germs. I mean, preventing the spread of infection, that's number one for sure. But the technique is also designed to keep everything organized, save precious time, and uphold the highest professional standards, even when you're in the, let's say, unpredictable setting of a patient's home. So how does this actually work in the real world? Well, it all starts with a solid foundation. The entire bag technique is built on 4 incredibly simple yet powerful principles. Honestly, if you remember just one thing from this section, make it these 4 words: clean, safe, aseptic, systematic. This is the mantra. Every single action the nurse takes is guided by these 4 ideas. It's the philosophy behind the procedure. And here you can see exactly how that mantra plays out in the real world. These aren't just suggestions, they are hard and fast rules. The no floor rule is probably the most famous one, but just as critical as washing your hands before and after, and making sure that bag is zipped up tight right after you use it. Okay, so those principles are baked right into a very specific sequence of events. Knowing the why is one thing, but mastering the how, the actual procedure, is everything. So let's walk through the 9 critical steps to see exactly how it's done. Now, a little tip for anyone studying for an exam. Mnemonics are a lifesaver. This sequence here, PHOCPCHD, it might just look like a jumble of letters right now, but trust me, it's the key to remembering the entire process. We're about to break down what each one stands for. All right, let's look at the first 5 steps. It all kicks off with preparation, finding a clean spot and putting down a barrier. Then step 2, absolutely critical, hand hygiene. Only after your hands are clean do you move to step 3, opening the bag. From there, you create a clean field for your instruments. And finally, step 5, you perform the procedure itself, making sure everything stays sterile. But you're not done just because the main task is over. Not even close. Step 6 is all about the aftermath, disposing of waste and cleaning your articles. Then, and this is so important, comes the second mandatory hand washing. After that, you systematically close the bag, and the very last step is documentation. If you forget even one of these, you risk breaking that chain of asepsis. Knowing the steps is one thing, but what really separates a beginner from an expert is knowing what not to do. This is where the real mastery comes in, and it's often exactly what examiners are looking for in practicals. This slide sums it up perfectly. Your do's are all about being proactive, right? Keeping the bag clean, checking expiry dates. But the don'ts? These are the absolute red lines. Putting the bag on the floor, mixing clean and used items, reusing disposables, any one of these actions just completely undermines the whole point of the technique. And here they are, the classic exam traps. Think about it. Each one of these is a direct violation of a core principle. Opening the bag before you wash your hands, you've just contaminated the whole thing. And placing the bag on the patient's bed, that's really no different than putting it on the floor. These are the tiny details that have huge consequences. Okay, so we've gone through all these steps and rules. Now let's zoom out and ask the big question. Why does this all matter so much? Let's connect this specific procedure back to the bigger picture of what community health is all about. When you look at it this way, the advantages are just so clear. Yes, it's portable. Yes, it's efficient. It absolutely saves time. But the number one benefit, the one that everything else is built on, will always be preventing infection. That is the absolute bedrock of safe patient care. And we want to leave you with this final thought. The bag technique, it's not just a checklist of tasks. It's a physical demonstration of a nurse's discipline, their attention to detail, and their unwavering commitment to a patient's safety. It's really just a small series of actions that builds a huge amount of trust and reflects the absolute highest standards of care.